Perfect. Well, thank you. And let me just share my screen here. Thank you, everyone, for attending and for letting me spend a little bit of time here with you this afternoon. And I will keep an eye on the chat. I will keep an eye on the Q&A to the extent that I can. And if you have questions, what I would ask is feel free just simply to go ahead and ask them. Be more than happy to answer them to the extent that I'm able during, and if not, certainly we'll have an opportunity for presentation at the end. I'm glad I get to jump on and see Matt's. Matt always does such a nice job, and his just sort of volume of knowledge about what's going on around the country from the perspective of EMS, policy always sort of blows me away. And I was sort of hoping to also get to see Asbel because, everybody needs a little bit of, because Asbel is always so fun and entertaining, but, so I know he had to shift to the morning. So, all right. So I know that we have sort of a different, there's a mix of folks in the room. And so I know for a lot of organizations, some of them are using volunteer labor and don't have formal benefit plans as it may be. Some volunteer agencies do have forms of sort of benefits that they offer their volunteers. We're going to talk about volunteer labor, I think, next session. That was the one that was going to be this morning, or volunteer compensation. We're going to do that after this. So, but it all kind of mixes together. So I don't mind if you've got questions. I've never worked for a volunteer agency, so I will tell you, I don't have really any idea what it's like to work for a volunteer agency. I have felt like a volunteer multiple agencies that I've worked for over the course of my career. I was a call firefighter. For those of you who don't know me, been an EMT for 33 years. I've been an employment lawyer now for about 20, but primarily worked not in the kind of lawyer that you all want to run over in the highway. The other kind of lawyer, the one that I managed EMS agencies, and for the last 8 years, really, I have had my own HR consulting and law firm that primarily focuses on EMS. And I do have a couple of small home health agencies as well. But the topic of overall, really, what we're seeing from the perspective of employee benefits and the importance of employee benefits really has been because of what's been going on with staffing, workforce shortage, and it has become even more and more prevalent since the pandemic. And so, when I did a presentation earlier this week in Pennsylvania, and when I, was probably 150, 200 people in the audience, I asked who was having problems with workforce, and nearly every single person in the room raised their hand. So really, one of the things that a lot of organizations are doing are shifting their position on employee benefits in an effort to sort of become a more competitive employer from the perspective of the recruitment and then even the retention. What I hear from a lot of organizations in the context of recruitment and retention are that a lot of folks will leave either standalone EMS agencies that maybe say don't have as robust a benefits packages, maybe a municipal fire-based or police-based or hospital-based organization. That is often what I will hear from people are, hey, they're leaving us because they're going to the fire department that has the formal retirement system, the one that, just for the record, is completely unsustainable. This is not a shot against fire departments, but it's just not a sustainable model. And many of those fire-based retirement plans are actually not fully funded, which is certainly concerning. So, just in the context of employee benefit program, one of the things that we know, given what's going on with the shift or the dynamic in which people are looking at employment, is that we know really that now, by and large, while wages and salaries have gone up somewhere in the area of around 12 to 25% over the last few years, one of the things that really has driven people from the perspective of recruitment and retention is benefits. And so what, surveys that were performed by different groups, one such as Glassdoor, said that when they were surveying employees, and I like Glassdoor a lot. If you're an organization and you have never searched your organization on Glassdoor, you should. Glassdoor is a website, if most people are familiar with it, or many are, but I still occasionally get people who aren't. Really, it's a place where employers are. It's sort of it's almost like an Angie's List for employers, where people can go and they can give feedback on employers and talk about employers, about what it's like to work for them. And in fact, it's one of those websites where I find that people really are very, very direct. Now, my experience by and large has been that it's kind of like the Amazon reviews, that a lot of times the people who will go on there to say that, or to provide a review, are people who are unhappy. The one thing that I really like about Glassdoor is you have to sign up for Glassdoor in order to provide a review on a particular employer. That doesn't mean you can't do so anonymously. It just it does sort of level the playing field a bit, because you can't just simply go on there and provide a review without at least Glassdoor knowing who you are. One of the things that I know an ambulance service out in the state of California, Royal Ambulance, has been now voted several times by Glassdoor as an employer of choice and one of the better places to work. This is an actually pretty amazing feat. I know in the Boston area, the Boston Globe and some of the newspapers used to have a process where an employer could essentially apply to be an employer of choice. And one of the things that I always thought was interesting was you had to pay to apply to be an employer of choice, which I thought felt a little bit like a pay-to-play arrangement. The one thing I really like about the Glassdoor awards are, generally speaking, those are awards that are given by the discretion of the folks at Glassdoor based upon what they've seen by what employees say about the employer. So I am not aware of any other ambulance service ever that has been awarded that award before. And so it's really pretty impressive. And one of the things that Steve and Eve Grau, who are the owners of that organization, have talked about is trying to build a compensation and benefits package around offering that employee something that really is valuable to them. And looking at many of the surveys, MetLife does a survey every year about employee benefits. 2 out of 5 workers, strongly recommend their company is a great place to work. Basically, more so today based on the benefits that are offered by the employer. Now, what I heard during the pandemic was folks were raising wages and we were creating EMS mercenaries, people who would just essentially follow the dollar. At the end of the day, one of the advantages to having a really strong benefits offering is that you can limit some of that. The folks, or your folks who are smarter, wiser, and understand the value of benefits. And we're going to talk about total compensation statements as we move along here. And by the way, anywhere that I reference sort of a document or a form, I have a copy that's set up so that you can just simply download that form. It is typically in a PDF format where you click on the upper left-hand corner. It allows you to upload your logo, and then you can use that form as your own. And so anywhere I reference that, where we're going through some of these things, talking about work comp or total benefit statements, or some of the other things that we're going to chat about during the next couple of hours, I have forms for those that I will just give to you. Now, if you look at those forms and you decide, geez, I really wish it had, maybe it's had this language, or maybe there's something on there that we're doing that it would be great if there were a provision for that, just reach out to me. I will work with my graphics person to possibly amend that form and then get it back to you. But, the challenges that we're struggling with EMS is that we're competing with not just other EMS employers. And it used to be that essentially our folks it was a limited pool of people who were primarily only looking and were only consider working in EMS. Today, we, are really competing with more industries, because people are not, in my opinion, as committed to necessarily or pigeonholed into one particular profession. In fact, a few years ago, before the pandemic, I remember losing an employee to the food court at the mall. And primarily one of the things that they stated was, I always get out on time and I get a free meal. So, you know, what I'd say is when we're hearing about these really amazing benefits programs, you know, Google has, of course, professional chefs. They do these biweekly chair massages. They have yoga classes. They have haircuts. That's something that we're not really probably ever going to be able to, and I'm not even sure I would necessarily suggest that we offer to folks, but what I would say is keep in mind that people are getting very innovative. And as a result of getting really innovative, you are now competing with others as it relates to workforce. It's not necessarily, you're not just competing against another EMS agency or fire department. So of course, employer costs are rising and the financial pressures are greater. We know that for a fact. We are watching as the number of hours that we're expecting people to work have increased, the number of trips that they're performing during their typical shift have increases, the number of skills that we're asking for them. I know the stuff that we were taught back in 1989 when I took my EMT course, and the skills that we were providing, or the services we were providing in 1990, or look a lot different and frankly a lot more limited than what we were providing when I did my last ambulance call in 2020. So we're asking a lot more from folks, but by and large, a lot of ambulance services are still offering the exact same things that they were offering back 20 years ago. And the fact of the matter is, while health insurance and dental insurance, and possibly short-term, long-term are sort of what's expected these days, it's important that you understand that you need or can use benefit plans to be a lot more strategic. And in fact, what we found are, because of the incredible high rise in cost, as Matt was talking about high deductible plans, we know that the average deductible has nearly tripled over the last 15 years. And what we know are the premiums have increased. So the downside to the Affordable Care Act was this idea that we were going to make essential health benefits more affordable for people so that everybody could have health insurance. What happened was the health insurance plan shifted to this idea that if consumers were responsible for, the potential financial risks of choosing healthcare, that they would make better choices. So if I understood that I could get my knee replaced at the Mass General for $100,000, or I could get my knee replaced at the Beverly Hospital for $50,000, and there's patient satisfaction scores and success rates were essentially identical, the argument at the time the ACA was passed was that people would make the more financially responsible decision. What we know about human beings are, number one, they're incredibly poor assessors of risk. And then number two, if I have a choice between getting my knee replaced at the number one healthcare facility in Massachusetts and arguably, one of the top 10 in the country, I'm probably going to pick that, even though it's not like I'm a running back for the New England Patriots. So we're horrible assessors of risk, and we also make really ridiculous financial decisions, as evidenced by the fact that our folks come in making whatever they're making. They then start working overtime and gross their salaries up to an amount by working a lot of overtime, and then they gross their lifestyles up to match that overtime, which of course puts them in a position where they no longer can reduce their hours. So we as employers are spending more money on the health care and other benefits that we're furnishing. So are employees, but the generosity of those benefits, and in fact shifting to high deductible health plans or health plans that also have flexible spending accounts, or HSAs, those benefit plans, right, are in fact essentially meaning that for most people with a high deductible plan, they're fundamentally funding their own healthcare almost completely. Why? Because only 25% of individuals ever hit the maximum deductible. So if that's the case, 75% are functionally eating that, or eating a portion of that deductible, and the plan is never really picking up the benefits that in fact they're really offering. So what we know is, Mercer and others do annual surveys every single year, and what we see is over the last year, the average cost per employee for health benefits generally, or from employer-sponsored health plans, went up roughly 3.4%. Now, what's more concerning is that it's projected next year to go up 5.4% on average per employee. And if you're not watching for that as you're doing any budgets or as you're preparing for the following year, and a lot of times, by the way, you've prepared your budget far enough in advance before reports like this come out. Typically, Mercer releases their report in November, so we don't quite yet have the report for what next year's benefit costs or what will happen with next year's benefit costs. And for many of you, if you're on a fiscal year, you had to submit your budget a long time ago. So it really, this is where looking at historical trends is really, really important, because it is certainly predictable, as you can see here, right, in the graph. The Kaiser Family Foundation, right, talks about, geez, what's the average single family cost for the employee, and is generally $1,300 for single, nearly $6,100, or a little more than $6,100 for a family for healthcare, and just healthcare. My wife, former EMT, now a physician, we're going through open enrollment with the Mass General Brigham of all organizations. She works for a physician organization that's owned by Mass General. Their healthcare benefits are going up by, I want to say, 45%, not the benefits that we receive, the costs are going up 45%. And interestingly enough, they're switching the model this year to say that the only place that you can get healthcare is at the Mass General Brigham or one of its providers, which really doesn't make sense to me, because if in fact they know what the cost to provide care is at their own darn facilities, why is healthcare going up when they, for the first year now, starting in 24, will require that any covered life get care at a Mass General Brigham facility? Before that, I could actually go to systems outside, even though it was a Mass General Brigham plan. So, you know, we see a whole bunch of stuff happening with employee benefits. If you are at all dialed into employee benefits, one of the frustrations that I have with any broker are, there's this game that the brokers play every single year at plan renewal. It's this same thing. They start to reach out to you usually about 6 months before your plan renews and says, you know, the early data is looking rough. Looks like you have some high claims, but it's preliminary data. We should probably meet to talk about it. And they come in and give you sort of might be a 22% increase this year. Then you get 3 months out from renewal and they go, geez, the numbers look a little bit better. I'm working on getting it down for you. So it's you know, maybe 18 to 20% increase this year. We should come in and talk about it. And they come in and waste another hour of your time, because truthfully, those projected numbers aren't going to really help you, because it's part of the game they're playing. Eventually you get to renewal time and they want to make you feel like they did you a solid by getting it down to a 12% increase or a 15% increase, because they set your expectation or they anchored you back at 22% 6 months beforehand. If you have had the same broker for years and years and years, one of the things that I tell folks are, go out to the market to see what other brokers may be able to do for you. Because a lot of times, while I do value long-standing relationships with insurance brokers or benefits brokers, there's your liability insurance broker, but then there's your benefits broker, and then also even your 401k or your retirement plan broker. What I would say is, make sure you go out, because once they believe that essentially they've got your business, the incentive for them to continue to earn your business is relatively low. So, you know, this is benefit stuff is not just simply, hey, we're going to take whatever comes our way. There are, in fact, ways in which you can work with your benefits to be a little bit more strategic and to hopefully maximize the, I don't want to use the term benefit, but functionally that's the best term, the benefit to your organization, right? What you're looking to do is figure out, all right, we should be planning up to 12 months in advance about what it is that we're going to offer and how we're going to be more strategic the following year. Because you want to look at what benefit plans you're offering versus what other folks are offering. as well as your overall company goals, right? What are you trying? What's the purpose of offering benefits in the first place, right? Why are we doing it as part of a larger strategy with either workforce retention or workforce for recruitment and or for managing organizational costs as it relates to benefits? So how can you be a little bit more strategic? You need to be very deliberate and take control of your benefits plans, right? This is not just something that you sign off every year because you think you get what you get and you don't get upset. What I would say is understand that your benefits also have a very, very direct impact in your corporate tax rate. And, you know, if you can work with your accounting firm as well as your insurance broker, you can actually maximize some of the financial benefit that your organization gets by being more strategic about how you buy and or how you position your employee health plans or your benefit plans. So typical basic benefit package, right? Health, dental, retirement, and then some sort of supplemental, right? The most offered benefit plans for organizations are health and dental as a rule of thumb. There are, of course, multiple types of health plans that are either, you know, PPOs or sort of in just standard indemnity type contracts, high deductible plans with HSAs, FSAs. One of the things that I do want to make sure I emphasize is if your organization is not using an HSA, if you have a high deductible plan with an HSA, there's a missed opportunity there, because the one thing that I really like about health savings accounts, which is different from a flexible spending account, you put a certain money aside, tax deductible. If you don't use it, you lose it at some point in the year. What I like about a health savings account or an HSA is that it is an account that, first of all, is portable. So if I work for Kim at his ambulance service and I put money in the HSA and I go work for Tim, I can take that plan with me and the money in that plan with me. The money is taken on a pre-tax basis so that it lowers my overall taxable income. That money is invested like a 401k into the stock market and grows like a 401k. That money is not taxable until such time as you use it, only if you don't use it on medical expenses. So if, very much like a flexible spending account, you use the HSA for those permitted medical expenses, well, then that money taken out of your HSA is a tax-free event, right? So that, you know, for example, there's been pretty broad leeway with what you can use an HSA for. When you spend that money, it is a tax-free event. Now, if that, you know, as you work your way through, and by the way, that account can continue to grow and be used even once you become eligible for Medicare. You can use it to offset some of your expenses or deductibles or any of that kind of stuff. The thing that I really like about it is, if in the event that you don't use that money at some point in your future, you can pull that money out just like a 401k. It is at that point, if you don't use it for medical expenses, at that point, it's deductible just like a 401k withdrawal. So it's important that, I mean, it's really, it's what they call the triple tax savings, because it is deducted pre-tax. The growth is tax-free. So if you put in 120 years from now, you have $1 million, which would be amazing. That growth is completely tax-free if you use it for medical expenses. So, and then of course, when you use it for medical expenses, it is tax-free. That's your third tax saving. One of the things that I say to folks importantly though, is that it is portable, so that it's not a use or lose, and you can take it with you. The other thing is, functionally, as an organization, organizations can also match some of the money, or can do what I say harbor plan, which essentially just puts money into an HSA for an employee. And the advantage to that is that if you can get your folks to functionally self-insure a higher deductible, so let's say today, because I'm concerned about being able to pay $1,000 deductible, I'm putting aside money. Well, if I put aside the $1,000, when I hit that deductible, I can just pay it tax-free, right? I can use that to, but if I actually don't hit the deductible in a year, and now next year I happen to have $2,000 in the plan, right? As I'm growing and that money's growing, I can start to go, geez, well, now I have $2,000 in the plan. Maybe I'll go with the $2,000 deductible because I have no financial risk really whatsoever. And so if you're a family-based plan and you can put away the $6,000, which is the average family deductible right now, then you are functionally self-insuring, right, that deductible. And as a result, you can actually lower your overall expense because you can then pick a less rich plan or a plan with a higher deductible because you're protecting your downside on the deductible, if that makes sense. Questions on that before I go any further?
Yeah, I have a question.
Yep.
Can you use HSA monies to also pay for the monthly plan premiums? If it's $350 for your share, and let's say your employer is $1,000, can you use your HSA to pay the $350?
That's a flippin' great question that I have no idea, but I will find out for you. That's a great question. That's a really good question. I've actually never been asked that question in 20 years. But my sense is if it's it wouldn't, so if your premium is, say, deducted out of your paycheck, my sense is, my guess is, and this is just an uneducated guess as it really is no. However, let me research that. I know you guys have another day tomorrow, and I will, if I can do it during the 15-minute break that we have, I will do it. If not, I will get back to you guys tomorrow if that's okay. Does that work?
Perfect. Thanks, Scott.
You're like, well, what's the option, right? So that's a great question, though. I really like that. I will find out. I will find out. So any other questions? Oop. Other questions? Go ahead. Nope. Okay. So
hands or anything, so go ahead.
Okay, good. No, I heard something. I wasn't sure. So that's one of those ones that when I try and convince EMTs and paramedics to enroll in an HSA, they go, there's just no way I can possibly afford to, I used to have people would walk in and go, I need to end my, my AFLAC or my supplemental insurance. And I'm like, it's $3 a week. And they go, yeah, no, I can't afford it. And I'm like, okay, all right, well, that's the kind of thing where I say with an HSA, hey, if you can afford to do it, or even better yet, if you're an organization that can afford to do what is a safe harbor plan, or at least even participate in some way on behalf of your employees, the important thing will be really in communicating and making sure that you build that, make sure you're painting the picture for them at how valuable that really is. In other words, it's basically like offering them a retirement plan with a match on top of that. So and again, it's about communicating. And we're going to talk a little bit in a minute here about how to communicate benefit plan stuff to folks based upon where they are in their life, because what was important to me at 20 is maybe not what's important to me at 54. So one of the things that I would suggest you do, if you haven't already done so, and a lot of people think that this is just a function of, hey, once a year we sit down with our broker and we do this assessment. That's not what I'm really referring to here. What I mean is sit down, look at your plan design, talk with your employees about sort of how are the current benefits working? How easy is it for you to access benefits? How easy is it for you to get benefits paid? Are there benefits that we currently don't have, or are there areas in the plan that are potential holes or weaknesses? Because one of the things that you will find is that, first of all, our people are not very, EMS folks tend to be higher utilizers of healthcare than many. And I notice my screen is going dull. It goes blurry after a while. I look so much better when I'm blurry, but I don't know if it's just a function of our Wi-Fi here in the office building. But in any event, what I would suggest is talking with your staff, because a lot of times folks who are up in the leadership or the management tend to already sort of have some level, just through years and years of experience of dealing with benefit plans. They sort of know how to navigate the benefit world. What I would suggest strongly is in having a one-on-one conversation with your team to say, have you used the plan? A lot of your 21 and 22-year-olds will not have, but what you're really putting out the note that says, hey, we're trying to conduct an assessment of our existing benefit plans. What we're wondering is, how are our current plans to deal with? How is our current plan designed to deal with? And what are areas that you wish, that we had? For example, what are competitors offering that you think or wish we would offer? The other thing I would suggest is get utilization data from your broker. And I don't mean just your healthcare broker. I mean your dental broker, your supplemental brokers. Find out what the utilization is for a couple of reasons. Number one, what you may find out are people aren't utilizing the benefits because they don't actually know what they have available to them. And as we know, like during COVID, a whole bunch of people put off a bunch of preventative health care. And if you've got a bunch of folks who are putting off preventative health care, that down the line really can cause a significant challenge. Take a look at your supplemental plans, your life, short-term, long-term disability, your accident and illness plans. A lot of folks tell me that depending upon the plan provider, so some folks have said Aflac, the duck, can be a little bit challenging on some plans, but not on others. The accident and the illness plans, boom, they pay out with no question. But on the short-term or long-term disability, they run into medical record issues, or they run them around the loop. So what I would suggest is doing that assessment, talking with your folks, looking at utilization, because what you may find are that you have plans that you're offering that no one is using. And what you may find out is nobody cares. Like oftentimes I'll find people would rather that we offer pet health insurance than we offer vision or orthodontic treatment. And interestingly, I have pet health insurance. And by the way, it covers nearly nothing. So I don't even know why the heck we have it in the first place. But really getting, but by the way, we'll spend an inordinate amount of money on our pets. I love my yellow lab, don't get me wrong. But every single time I submit a claim into Healthy Paws, the health insurer, they go, sorry, that's not covered. What is your current staff, think about the plans that you have. Do surveys. Survey Monkey, you can do very easily. Anything under 10 questions, generally they do for free. The only thing that I would suggest is publish your survey results, because your folks are going to be convinced that you're keeping something from them. That's sort of a natural suspicion of EMS folks. But number two, once you get those results, not only should you publish them, but you need to act on them, right? Because a lot of times what we'll find are that if you in fact ask the question, but then you don't do anything with the results, people will, by the way, stop offering their opinion. A lot of times, if your response rate is really, really low, you may be asking the questions in ways that people just don't understand. For example, at 21 or 21, when I got my first EMS job, I had no idea really what a deductible was. I mean, I knew sort of in theory, but I had no idea how it operated. And so what I suggest to folks are, when you're doing enrollment for new employees or open enrollment, take a few minutes and explain take a 10-minute segment and explain one portion of how the plan works, right? And what it means. And I cannot tell you how many times I've smiled and shook my head that I understood something that I had no flipping idea what it meant. I just hope no one else figured out that I had no idea what it meant. So don't just take that initial answer as the answer. A lot of times people may be disengaged. They may not be responding, not because they don't understand, because they don't think you're going to do anything about it anyways, right? Based upon prior results. But again, get out there and ask folks about it. Interestingly, when we take a look at what people value, and there's another survey that I don't have in here, when we talk about what is it that drives people to a job, just so you know, 65% of employees value, that was the highest number, value wages and benefits. The second one, as you'll see here, is only 3% difference, but in this instance, they have, they really have up in, 80%, 88% said that they value work-life balance. Now, I don't know about your experience with EMTs and paramedics, but my experience is that we're pretty flippin' awful with work-life balance. For those of you who work in an EMS leadership role, and I'm presuming, how many of you in the room, I can see you even though you're literally this big. How many of you in the room are EMS leaders? Is it all of you? Okay, let me just ask you, how's your work-life balance? Getting a lot of time, just chilling out, watching Suits on Netflix or anything? Yeah, or are you sending emails at 10 o'clock at night and wondering how the hell you get anything done? My experience with folks are their work-life balance is awful. So just so you know, the average person coming into the workplace today values work-life balance almost exactly as much as they value pay. And it is why we are seeing people leave EMS and or not come. They find out that functionally when they sign on to EMS, it's like doing a hitch at San Quentin, right? You're in and you're in for the whole time, all the time. So when you're thinking about what you're offering, it's important to recognize what's valuable to them. Because if you are offering a 21-year-old a retirement plan, even though you know and I know they should be taking advantage of that retirement plan, for a 21-year-old who will likely live to be 79.6 years old, the idea 79, retirement seems like a very, very long way off. So things like free gym memberships and so forth may be more valuable. Understanding, right, that benefits, depending upon who you are talking to and what segment of your workforce you're talking to, they have or value benefits differently. And in fact, at 54, a retirement plan seems a lot more, in a healthy health insurance plan seem a lot more important to me than they did at 21 when I first started in EMS. So recognize that if you're going to communicate about your benefit plans, that you have to set your communication for people who are in that 20, Gen Z, a millennial, and then maybe your Gen Xers, and you're very likely, not likely to have a lot outside of the Gen Xer generation, but making sure and understanding that you need to build your communication so that they can communicate to the 3 different levels. Because if you just send out the message based upon your point of view, you are speaking in a language that they quite literally don't understand. If for any of you, I have 2 teenagers, one's 18, one's 16, senior and a sophomore. If I email them, the chances that they're going to respond are virtually 0. For those of you who know Brian Werfel, the Medicare expert for the AAA, his email is bwerfel@aol.com. I'll let that sink in just for a minute, because nobody has an AOL account anymore, unless I hear from maybe Kim. Kim, do you have an AOL account?
No, I know people that do though.
All right. Well, what I'll tell you is, depending upon the mechanism in which you try and communicate benefits, you may be communicating in a manner like when I call my daughter, it immediately goes to voicemail. I get a text that says what, and I text back, I would like to talk to you, right? But for your average 17, 18-year-old, they don't want to speak to you. They want to text. So you may need to build communication strategies that are speaking in a language that resonates with those folks. The other thing that I would suggest too are, this may sound foolish, but number one, if you have a website for your organization and that website has pictures of other people that like you bought off of Big Stock Photo, those ambulance pictures where people are wearing jumpsuits. I love the European jumpsuit, right? When people are wearing jumpsuits, they know, you know what that says? We don't have anybody we like enough to put on our website, right? So take pictures, it's relatively inexpensive. Take pictures of your own folks and put them on the website. The other thing is, don't say we have competitive benefits and wages. That is, geez, we really don't want to talk about how crappy our benefits and wages are. So we're just going to say we have competitive benefits and wages. Be different. Actually, in many states, you're required now when you post a job to post the pay scale. So what I would say is post your pay rates. By the way, go on Glassdoor. Everybody knows what they are anyways. So for me, I would take the organization. Gen Zs like transparency. So what I would say is I would go with the organization that's being completely transparent. Now, what some people go is, well, I don't want to release my pay rates, man. Someone might, right? That may get to my competitor. Nonsense. They already have them. I promise you that. So don't even bother. The other thing is, it never hurts to create or come up with a marketing slogan or a logo for your benefits. I know that sounds maybe fuzzy, but what I will tell you, when people take the time to come up with a plan or come up with a slogan or come up with a logo for their benefits, it tells you that they're being intentional, that they've thought about it, and that they are working to, you're trying to sell them on your benefits plans. You do need to educate your folks because, again, this survey here, right, that 9% of HR leaders believe that their teams are knowledgeable at all about their benefit plans. Right. And so in most organizations, the only person who really knows the benefit plans is the person who serves in the HR role. But generally speaking, most people have no idea what the benefits are, even at the leadership level. All right. Typically, when it comes to benefits education, it's, hey, we're having open enrollment. We've sent out the packets that supposedly, how many of you, when you got a health insurance packet, read through the whole thing? What you probably did was look at what's it going to cost me if I go to an emergency room and what's it going to cost me if I go to a doctor's office. The funny thing is I listened to Matt talk about balance billing, and we'll talk just a little bit about that later today. How many of you have any idea what your insurance pays if you end up in an ambulance? I saw a hand go up. We're ambulance people. That should be the first thing we look at. But the reality is most of us have no idea because why? We perceive, knock on wood, that our risk of ending up in an ambulance is very, very low. So make sure that you understand, right, that you go past beyond just sending out a packet, that you provide some level of education, that you talk. A lot of times your brokers can furnish that education, but what I would say is don't leave it to them and them alone, because at the end of the day, once they know you're enrolling, the sale is done. They're going to earn their commission and they're going to do just enough to get them through. So I would get into the weeds of the plan offerings. That's one of the things that I think is important, so that people really, truly understand, and then put it in a context that might make sense to them. Like, hey, if you end up at an urgent care, here's what's going to happen. If you end up at your doctor's office, here's what's going to happen. Don't just leave it to the $10 copay. So I want to talk a little bit in the remaining few minutes here about some newer benefits ideas, which may or may not be new to all of you, but I just think it's important to really chat a little bit about it. A lot of folks, of course, are on fully funded healthcare plans. And I understand the reason why a lot of people do that, because self-funded plans can be very, very challenging. However, what I will tell you is, generally speaking, organizations do better financially with either self-funded, partially self-funded, or captive plans. There is a captive health insurance plan out there that deals primarily with EMS organizations. And just so you understand the nature of a captive, it is your organization is essentially pooled with a bunch of other like organizations with similar risk profile, and you pool your money to create your own insurance plan. And that plan, the wonderful thing about captive plans are they can basically write the benefits to be whatever they want them to be. So you can really tailor up or down. And if at the end of the year, the captive does well, then the member company gets money back and can either lower their premiums for their employees, or they can use that money for other purposes within the organization. So self-funded, partially self-funded, and captive plans are, from a financial a strategy perspective, they are something that is in fact growing in popularity. In fact, we see captive plans on the insurance side growing pretty significantly because of what's happening with insurance rates across the country. So captives are often thought of just in the context of like auto and or liability, but also they are available in health plans as well. Employee wellness initiatives. So a lot of folks, when the high deductible plans came out, they started offering employee wellness options. Now, my personal feeling about employee wellness are, if you think you're going to institute an employee wellness plan and all of your folks are going to get better, it's the equivalent to saying, we're going to buy every employee a treadmill, and in a year, everyone will be fit as a fiddle. The reality is treadmills sit in people's basements with clothing over them and or out at the curb in the rain very quickly. Buying a treadmill or instituting an employee wellness plan by itself is not going to do a darn thing, except for it will shift the more of the cost of employee health benefits over to the employee who isn't following the wellness plan. It is a strategy used to essentially say, hey, those who participate or who meet the wellness plan initiatives will pay a lower amount than those who don't. The challenge that there was a study released out of the University of, I want to say Indiana, a couple of years ago that said, by and large, wellness plans don't work because the only people who sign up for wellness plans are those who were already healthy. So they were already doing the behaviors that they were going to buy a gym membership, whether or not you discounted it. They were going to take advantage of the benefits. They were going to pay for them themselves. And really, essentially, the unhealthy people continue to be unhealthy. However, this is a mechanism for reducing healthcare costs for the organization. And if you have employees who really are interested in getting fit and using the wellness program, then they can save some money as well. And because if they're already going to do it, this is a way in which they can essentially find money. All right. Questions to this point? Some of this benefit stuff, I'm so sorry, it's just a little bit dry. And there's not, I mean, what I could do is like, maybe like put it in the context of like bringing something EMS related, like a car crash or something, but they're just not very exciting, unfortunately. But this is an area in which it's critically important. A lot of people put it on autopilot, leave it to their brokers. And at the end of the day, those monies go up every single year, and people perceive very little value. Healthcare navigators or advocacies, those are things that I think have proven to be very, very beneficial. When you have a healthcare navigator where there's a service where they can pick up the phone, and a lot of the health plans already have this, and it can say, hey, where do I go to get the next service that I need? If your plan doesn't offer that, go with a plan that does offer it, because it'll help your folks find the benefits that they need within the market that they need it at the lowest cost they can get. So this is one that a lot of health plans already have, and I strongly, strongly, strongly suggest that you utilize this. Now, a lot of organizations or a lot of healthcare plans are already using PBMs. Those are pharmacy benefit managers. Essentially, this is the #1 cost management strategy right now utilized by health plans, because what we know are pharmaceuticals are incredibly, incredibly expensive. And the other thing that I've learned after years and years and years at looking at benefits utilization for health plans, our people are on all kinds of drugs. They're just on all kinds of drugs. And so if in fact they're on all kinds of drugs, what you need to do is use a PBM so that you can find a way to address those costs and negotiate lower costs for your plan. So PBMs, generally, they're primarily responsible for developing and maintaining a formulary, and that contracts with pharmacies, negotiates discounts, rebates, and finds ways. Essentially, they negotiate with the drug manufacturers to try and find or get a better price. A lot of times the PDM are negotiating on behalf of multiple health. They've got a lot of lives under them, so they have a stronger negotiation, kind of like the SABIC buying group when, getting bids from Furno for stretchers or from Stryker for stretchers. They say, hey, we've got 3,000 ambulance services that are members of the SABIC buying group, give us a better price. It's exactly what PDMs do. They also will work with chain pharmacies to try and negotiate better prices. What we know from multiple studies, essentially the medication trends are one of the fastest growing expenses in medical costs. Really, they're exceeding the cost of medical claims as a general rule of thumb. And, they're with inflation and with the limitations, as Matt talked about, with the limitations on medications, PBMs can be really helpful in finding medications that you need. For example, right now, Ozempic is first of all, everybody's on Ozempic. If all of a sudden you see a whole bunch of people looking super fit and fiddle, it's because they're probably taking a medication to help them lose weight. There's nothing wrong with that. Generally, Ozempic is a medication for diabetics. However, one of the challenges and the reasons no one can seem to find it are because all the med spas are writing scripts for people to take Ozempic to lose weight it's for health reasons, but it's primarily for visual appearance reasons than anything. PBMs can help find those medications that your diabetics really, really need, like Ozempic, to get their A1Cs down, but they can't find it because all of the med spas have picked up all the medication. So using those PBMs generally can reduce those costs by 40 to 50% annually. So it is one of those investments that's well worth it. Technology is another thing. A lot of the plans are now starting to have their benefits and accessing their benefits over a mobile application. If you are doing benefits enrollment, push your benefits broker to work with to make sure that their enrollment process can be done on a mobile device. I don't know if you guys have had this experience, but generally speaking, my kids won't look at a laptop unless they're going on to do something for school. Otherwise, they're on their mobile device. By the way, my kids are now getting at the age where they could work on an ambulance service, even though I think of them as little. What I'd say is what's appealing to them will appeal to your workforce as well that are coming in. If they have to go to a computer or fill out a piece of paperwork, by the way, they would rather quit your organization than fill out a piece of paper. So make sure that your broker is investing in some level of technology, that you have mobile platforms, that there's some level of self-service. The only thing I would caution you with self-service is there are times I go to the grocery store and I'm happy to go through the self-checkout. There are other times I go to the grocery store and I want nothing to do with the self-checkout, because every damn time I go to the self-checkout, I have to wait for someone to come over and clear some item that I didn't put quickly enough in the bagging area. Same thing can be said for self-service on these benefit platforms. Web portals and telemedicine, we're pushing for treatment in place and telemedicine. So are all of the physicians. COVID did wonders for this. And I know my wife is still doing telemedicine visits with her patients on a pretty regular basis. What I would say is, if in fact you liked it, so will your staff. So look at what benefits are available as it relates to web-based medicine, because your folks, by the way, if they don't have to take a day off to go to the doctor because they can do it while they're in the break room, all the better for us. So HSAs, I talked a little bit about. They can only be used in conjunction with the high deductible health plan. And generally those contributions, as I said, it's a triple tax savings. I would say this is the number one benefit that is, generally speaking, underutilized or under subscribed to or under discussed, because people don't really understand the idea of the triple tax savings. So if you spend a few minutes with people and explain, this money's going to come out of your gross pay prior to you being taxed. It's going to be invested in a tax-free investment account. It's going to grow in a tax-free manner. And when you use it, it's going to be a tax-free event unless you're using it for something that's not medical. And by the way, it is perfectly fine if you grow this account to be $100,000 and then decide to use it for retirement. That's perfectly fine. I have a friend who runs a company. The only thing the company does is help people invest money so that they have enough money for health care in retirement. That's it. They don't do retirement. They do investments for the purposes of having money in retirement for healthcare. That is when you will have the most expensive time in your life. It is hard to convince a 22-year-old that they need to prepare for retirement, despite the fact, just so you know, statistics say Generation Z folks think they're going to retire at 56. They're going to live to be 79. So they better have a lot of money saved. All right. Yeah.
There you go. Since you're on the HSA again, there was a comment came in, and I believe it's referring to CJ's question. Darren says, generally, health insurance premiums are not considered a qualified medical HSA eligible expense. A few exemptions are premiums paid for COBRA or other continuation coverage, Medicare, long-term care, insurance based on age, or premiums paid while drawing unemployment.
I'll tell you. And so, Darren, I think it's Darren who put that up. One, thank you very much. Sort of what I thought was that it wouldn't be covered, but I appreciate you confirming that. Number two, one really important thing is COBRA, right? One of the things that we hear from a lot of folks are, hey, I've lost my healthcare coverage because I stopped working or some other event occurred that I no longer qualify, and I would normally enroll in COBRA, but I can't afford it. This is one of those things where I'd say, geez, this is a great opportunity to offset. It's about managing risk. For most of our folks, missing one paycheck will have devastating consequences for them. And so I'm not suggesting that they can necessarily use this money because they missed a paycheck, but it's about if they miss a paycheck because they had to pay out a bunch of money in deductible, and as a result, they don't have money to pay rent or pay for food or pay their car. This is one of those things where I'd say really, really, this is the takeaway. If you take away nothing else from this, that you should be looking at HSA. So Darren, thank you for doing that. You just saved me from having to do a little research during the break. So thank you. Any other questions, Kim?
Any other questions in the room? I don't see anything online. Go ahead.
All right. So most of the time what I hear from folks are, hey, I can't afford to put money aside. I can't afford to do it. This is where I would say to folks are, okay, sitting down and having a discussion about, not trying to financially counsel people, but one of the benefits that are now growing substantially is in financial counseling for people and financial education. A lot of people use things like Dave Ramsey. What I would suggest they are not like when I graduated high school, we had a class on how to balance your checkbook. And, I don't think I've balanced my checkbook in 25 years because that's what the bank does for us. The reality is having some education surrounding, hey, listen, okay, well, maybe you can't afford to do it this year, but next year, you're probably going to get a raise of 50 cents or $1 an hour. Take half of that and put it into the HSA, or into your 401k. Again, I'm 54 today. I didn't graduate law school until I turned 33, which means I pay off law school 2 years before I'm eligible for Medicare. I sure as hell wish I had been saving 401k back from when I was 21 years old, rather than waiting until I was much, much older. So if you have employees who are Medicare eligible, this is another place where they can't, once they're Medicare eligible, continue to contribute to the HSA. But for those who are Medicare eligible, they can opt out of the employer plan and go on Medicare. That is one way to certainly do that. Certainly the last thing you want to do is look at your older folks and go like, hell, now you're on Medicare, get off our health plan. You're not going to do that. But they may find that is a more affordable option. And I know I'm running up against time here. So paid time off, I will tell you, in a lot of states, there are requirements for paid time off. And I frankly should have looked up Colorado before I jumped on here. But Massachusetts, for example, California have paid sick time. That is something that I will say that a lot of your folks, they like work-life balance, they like paid time off. The thing that I will say is, someone who was a manager, every single time, I'd get 5 weeks of vacation when I was the CEO of an ambulance service up here in Boston, but every time I went to take some time off, they gave me crap about it, right? And I'm like, well, it's not a benefit if every time I do it, you give me a hard time. So paid time off, this is an area where, from my perspective, we should be encouraging people. And that comes down to the total compensation statement. I do have a total compensation statement that I will send to Kim that he can share with you all. There are a couple of different versions of it, essentially, that allows you to plug in the information to show people what actually it costs you and what they're getting from your employer. So that when your competitor who offers them $1 more an hour, but they have no paid time off, you can give them say, hey, plug in their numbers, plug in our numbers, and see what you make. Because that will be important. Flexible schedules, of course, this is one why Uber was so popular as an employer. If somebody could Uber the schedule, I'll tell you what, I think you'd find that folks are a lot more, you'd have an easier time recruiting people. I think most people nowadays do have some sort of educational assistance program or have some kind of tuition reimbursement. What I would say is, this is an area that's important for folks like me who have school loans. Now, I consolidated at 1.3%, so I'm not dying to pay it off. But what I would say for a lot of our folks who are looking at paramedic programs at 12 to 14 grand, this is an area that's an opportunity. One of the bills that AAA is working on right now is to get 520 paramedic programs and EMT programs eligible to use 529 plan money. Right now, it's currently not, but there is a bill out there that's currently waiting. So we talked about this already, the financial counseling and debt counseling services. This is one that I think folks, you do see on average, they say, hey, look, 49% of employees are concerned or anxious about financial well-being. 25% state that they are less productive at work because they're thinking about how screwed they are financially. Again, the Dave Ramsey or some sort of debt counseling, I think, the goal is here, be talking to people about what they want to do in 2 to 5 years, not what they want to do 30 years from now. Say is, where are you looking to be 2 years from now? Retirement plans, we all know that most of the defined benefit plans are going away with the exception of those municipal plans. But a lot of folks are moving towards either profit sharing, and then of course many already have a defined contribution such as a 401k. Those really, there hasn't been a lot of movement in this area. It's pretty much the same way it had been. So I know I'm running 2 minutes over, but just, in summary, this is one of those things that it's not a set it and forget it. If you haven't strategically looked at your benefits, this is an area and an opportunity for change or improvement. So any questions? Because I know we got a few minutes. I think we got 5 minutes before the next one, and I've already eaten into your time a little bit, right?
It's your time, so any questions?
I hate when I eat into my own time. God damn it. All
Question
right, so
Here, go ahead.
PTO, do you
Yep.
have a preference in offering just straight PTO that one can use for vacation or time off, or separating
Good.
your sick from your PTO?
yeah, great question. One of the reasons why a lot of people are separating sick from vacation, because in a lot of states, if it's in a pooled PTO, when the employee gets terminated or quits, that PTO becomes wages under the law, and as a result, you have to pay it out. However, if you segregate those as sick and vacation, or sick and personal / vacation, you don't technically have to pay out the sick. What I'd say is employees like pooled, employers tend to like segregated because of that. A lot of people will build up big buckets of paid time off. So there really isn't a a preference. There's definitely a preference for employees is to have it pooled because they have more flexibility on how they use it. Your healthy employees are like, well, wait a minute. So I lose that time if I'm not sick, and what they do is suddenly become sick. But from an employer perspective, and this is a double check with your state, like state of Texas. So I'm barred as a lawyer in Texas, Illinois, and Mass. Texas, it's not payable to you. But Massachusetts, if it's PTO, it's payable to. So, it's not payable in Texas unless you say it is. If you say it is, then it is. So I don't know if that answers your question. I hope so.
Yeah, that's payable.
Any other questions?
Any questions online? I don't see any hands up. Anything else here in the room? Okay, Scott, we'll go ahead and take a 5-minute break. Everybody can use the if they need to.
And just
Back
again,
at one.
Darren, thanks for that comment. I appreciate it, guys. We'll see you back in 5. Okay, well, welcome back, everyone. And I know you are going to get a 15-minute break after this segment. So hopefully this will be at least relevant for some of you. And I will tell you, I don't do a ton of work with volunteer agencies, but last year, I do get these questions from time to time from AAA members and